tend to be around value chains. And that's critical because that's where benefits are derived. And along those production systems or nodes, those where the risks, One Health risks, are actually domiciled. So it's important to really think through those systems. So I'll just briefly present something around milk and beef, and that's based on their contribution to the marketed production in Kenya, based on the statistical abstract. Then I'll take you through something around disease surveillance, response, and the organizations responsible, a bit of diseases which are prioritized. And then I'll get into the One Health concept, how it's evolved in Kenya over time. I'll be a bit brief on most of the context, but I'll emphasize on that point C, where we have developed a One Health strategic plan for the University of Nairobi. And through that, then we'll start to see how then can we link to move the debate forward. So of course, this is the map of Kenya. I guess we should be somewhere up on the other north. And there is a reason why you have got all these major blanks areas, because those tend to be more of the pastoral areas. And that Kenya, of course, is currently divided into 47 administrative regions with a human population of about 48 million people. And of course, it will tell you that there is concentration of these people around the areas where you are seeing smaller divisions for the units. And about 83% of Kenya is basically ASAL. So it's basically similar to the system we are finding ourselves around here. With about 17 million head of cattle, sheep, chicken, and so on. But we also have wildlife. Because when you're thinking of One Health, then challenges can also come from the wild. And that's important to think through. And this is very important to try and start thinking of how do these production systems actually create benefits. Because as they create those benefits, then those are the various areas where you are actually going to have challenges. Okay, I think this has moved a little bit. So we have got climatic zones ranging from the humid, where you have got a lot of rain, to areas which tend to be more arid. And the nutrient source, we move again from more forested areas to wooded grasslands, and all the way to most of the shrubs. And that tends to be most of the country. And we have got several crops. Again, we are talking about One Health, so it also means not on animals, we also have plants. The risk can actually also come from plants. And a range of challenges or constraints around these systems, they could be within the humid area and also within the arid area. So Rift Valley fever has been highlighted here as a challenge which is affecting, which has been reported in Kenya. Trypanosomosis is also quite common, not necessarily the human trips, but that affects livestock is quite common. But within that range, you can actually have quite a lot of challenges that we need to think through. And it's not only diseases. We also have challenges around predation. So predation is quite common across most of the farming systems in Kenya. And that is a One Health challenge that we also need to think through. And with regards to economics, because if these systems don't produce benefits, then you agree with me that it will be worthwhile really trying to push in a lot of resources in there, unless we can demonstrate that it's useful to invest in them. And it's important to think through these One Health initiatives as a system. A system is where you have got inputs, they have to be converted to get some outputs, and you've got that cycle. As it moves, it actually produces some unwanted products. And those unwanted products actually could be the source of some of these One Health challenges. And that can happen anywhere, even here in Somaliland. So, of course, Kenya is more industrialized. We have got a lot of value-adding activities along the various food value chains, which can also be critical with regards to spread or introduction of disease. So we got issues around markets, commercial production along these value chains, ranging from areas where we have got plantations of crops, some which are integrated with livestock, ranches and feedlots. We are also keeping exotic breeds of animals, which are especially within the highlands, and also the indigenous, especially the Sahiwal, and other indigenous like the Borama. Those are very common within areas which are a little bit drier, but they are all exposed to diseases. That's the challenge. Kenya is known to be a major dairy center within the region, so we produce a lot of milk. But the question is it sufficient to support that population? And that also applies for the meat, given the number of animals. And there should be a debate around how then do you tackle this as the population grows? How do we manage the carrying capacity for these particular animals to ensure that people get quality foods from these particular systems while taking care of challenges of health and which could be from environment, also infectious diseases, which is the reason why we are really here. So there are other pipe products, for example, manure and others. So then I said these systems are important, but they must create benefits for us to start really thinking of investing heavily within them. And this is just from the statistical abstract from the Kenya National Bureau of Statistics with regards to contribution of various livestock sector to the gross domestic product. So you can see on the upper line there, that is the contribution that's coming from cattle and calves. That's the account. Basically animals which are marketed through various markets, through various slaughterhouses and so on. So it's actually a major contribution, and you can actually see that graph is actually rising. But the challenge is, with the coming of climate change, the environment pressures, we are actually starting to see animals actually dying in large numbers. Like recently with the droughts in the northern part of Kenya, there are several animals that died. I'm not quite conversant with what probably happened here. That is because of shortage of essential inputs, for example, water and pasture, which we need to think through. Because if we don't intervene, then that contribution will actually collapse. And next to it is actually a contribution that's coming from dairy. That may actually be deceptive. So it's only referring to milk, which is processed through the large manufacturing companies around Kenya, like Brookside and so on. It's not capturing milk which is being produced from, like those that are marketed within the communities, the smallholder, somebody's producing, having 2 cows. So that's not captured, but the contribution of milk could be much, much higher. But as systems grow, and as time our population grow, and because the carrying capacity tend to be quite restricted, it doesn't change. It's probably just decreasing. So we'll find a situation where these graphs, which are down here, especially those around pigs, the pig industry in Kenya has actually started growing. We have got a company called Farmer's Choice, which has been processing pigs and pig products. And recently they changed their procurement system for pigs, because they have realized there are now so many pigs that they can't just buy across the country. And that's a response to what is actually happening, because there's the growing demand for protein, which can now not be met by beef. And pig is an alternative, pig and poultry. I know we have got shortages, and that's what I want to present in the next table here, thinking through the various livestock numbers and the population across the country. We are now about 48 million people, and thinking around our dairy population of about 3 million. So you think like every person has got a share of 0.07 of a dairy cow. If you get the reciprocal of that, it means like you'll have 12 people standing behind one dairy cow. 12 Kenyans relying on one dairy cow for supply of milk. And what's likely to happen in the future? As climate change sets in, diseases comes with various challenges, these are likely to impact heavily on our systems. And therefore, the need for One Health approach in tackling these challenges, because you may assume, okay, this is more of an animal problem, the experts in that area will think about it, but the animal experts would probably not have sufficient knowledge around climate. So you need people from the environment and climate expertise to come and try and improve on the strategies around management of these critical resources. And so that runs down, and you can think, see what happens with indigenous chicken and also commercial chicken. For every Kenyan, for example, you have got a 0.56 of an indigenous chicken and 0.13 of commercial chicken. Yet Kenyans actually are known for consuming a lot of chicken. Within a period of maybe a weekend, somebody can eat, probably have a chicken or a chicken. So but this allocation is for a year. So it means there are parts of the population who are actually deprived of this particular critical nutrient source. And that brings in something very critical within the One Health concept, nutrition. Because if we don't tackle nutrition within these systems, these animals are supposed to provide us with foods to support growth and other essential developmental stages within the body. So if this is not provided, we don't have adequate food, then we really cannot think of a healthy population. And with these statistics, I know most governments in Kenya would always, sorry? You want to touch it some? So with these statistics, we may be thinking around what's our contribution to the export market. But you can only export if you have got a surplus. If you don't have a surplus, then it means you must only import. And that actually happens. For example, with our neighbors, I think we obtain most of our eggs from Uganda. We can't produce enough for us to consume. And if we closed our borders, then that upper graph there will probably collapse, because to a larger extent we have eaten most of our beef animals. So we rely on beef from the neighboring countries. That's how interconnected we are. And that's why One Health is very important. It's important that we actually see what is it that we can actually do within the region so that we ensure that we maintain and sustain a constant supply of these nutrients. Okay, so with regards to the per capita consumption, again, these are official records. So each person about 9.42 kilos of beef per year. And so this is not quite good statistics, especially chicken meat. It just simply means that there are a segment of the population who are actually not being sufficiently supplied with this particular needed. And most of our animals basically come from the pastoral areas.
Can you fit it somewhere here?
So I've already mentioned that most of the animals, of 80% or red meat that we get, most of it come from pastoral areas and often from our neighbors. And therefore, we need to work together. With regards to disease surveillance, control, and organization, so we have got a number of organizations working in Kenya to tackle this. First, of course, we have got the Ministry of Health, who are officially responsible for purposes of control or management of diseases in humans. We have Ministry of Agriculture and State Department of Livestock, where we have the Director of Veterinary Services, who are actually responsible for purposes of controlling livestock and animal diseases. And they have come together and created a body known as the Zoonotic Disease Unit. So that was also mentioned yesterday in Eric Fell's presentation. And they are controlling, the government are now putting out their personnel from both ministries, and they are coordinating management of zoonosis and One Health challenges across the country. And they are working with a number of organizations. For example, I know we have mentioned FAO, WHO, and other agreements, the OIE. And with regards to research, of course, we have got a number of research organizations. We have got the University of Nairobi and other universities. ILRI is the headquarters in Kenya, so we do a lot of work around animal diseases and, of course, zoonosis. KEMRI. So KEMRI is a large research organization focusing on human disease. We have CALRO, that's a national research organization with institutes spread across the country. ICIPE is regional, especially so dealing with pests, insects, and so on. So the Zoonotic Disease Unit has got 3 major goals. And they have developed a number of strategies for purposes of managing zoonosis. For example, yesterday we had the Bruxelles strategy, which is just been signed, was developed with this, with the help of this organization, and the goals are really around strengthening surveillance, establishing structures for partnerships, and conducting research. That's a list of prioritized diseases. I will not dwell so much on it. Quite a number of them have been highlighted, anthrax and so on. And so, One Health concept. Generally, most of what has been mentioned, we have got their share, transitioning into Afrohun, and operating in various countries, has been in Kenya since 2010. And this was actually one of the founding directors of OSHER. So he can give us more talk around that. And the universities which have participated in a number of One Health activities, the University of Nairobi, Moi University, Egerton University, and OSHER, which has transitioned into Afrohun. And so these are some of the projects. There are a number of them. Go High, which is led by Ohio State University, is also having activities in Kenya. And now briefly, I'll need to present this. So we have recently developed a One Health strategic plan for the University of Nairobi with a vision of having the Horn of Africa as a healthy and a prosperous region where communities and animals coexist in a disease-free environment. And that is critical for us, so that we don't look inward, we look outwards and see how we can connect with various institutions around. And our mission is to provide human, animal, and environmental health solutions through a collaborative One Health approach in training, research, and community engagement, and a range of strategic objectives, a number of them dealing with research, capacity building, but very importantly, Number 6, developing local, regional, and international partnerships. And I think that's so critical for us, that we see how we can work together to move this agenda forward to support the health of communities, animals, and the environment where we live in. And I would want to sum it up. That's just a brief of a number of things that I've stated there. And of course, the last bullet emphasizing still on the strategic plan for the University of Nairobi. Thank you.
Thank you very much, Dr. Jason. Now our country tour is taking us to Djibouti. And Djibouti we have Dr. Ali Bare coming in to make a presentation. Welcome. Maybe to facilitate him to walk faster, give him a clap, please. Give him a clap. Thank you very much.
Assalamu alaikum wa rahmatullahi wa barakatuh. First of all, I thank you for the organizers of this conference, which is interesting. Secondly, I will ask forgive me because my English language is very weak, and I ask excuse me. I will present One Health, a new concept in Djibouti. Comment? Quelle attente? I present the country. The Republic of Djibouti is a small country, 23,000 square kilometers, 1 million inhabitants, 6 regions. The climate is arid, small rainfall. In summer, the temperature is 40, 43, 45. In winter, less. The average temperature is 13 degrees Celsius. Livestock farming is the main activity of rural population, estimated of 150 people, with 1 million heads of small ruminants, 40,000 heads of cattle, 50 heads of camels. Djibouti has a very important livestock considering its population size. There are several animals movement to and from neighboring countries. Djibouti holds a strategic position for the development of livestock trade between East Africa and Middle East countries. Farming activities are the main source of livelihood to one segment of the population. and their production play a significant role in food security. Djibouti's health profile is comparable to that of developing countries. The main causes of morbidity and mortality are represented by infectious disease, diarrhea disease, malaria, respiratory disease, tuberculosis, HIV, etc. Certain diseases are of animal origin. Djibouti has a legal framework for the management of crisis. Health crisis and growing threats to human and animal life are chikungunya, avian flu, brucella, COVID-19, airborne and foodborne diseases, environment changes, antibiotic resistance. They think about about 60% of disease are from multi-host. Many emerging infectious disease are of animal origin. Food security requires proactive management. The current surveillance system is based only on the evaluation of syndromes, for example, flu-like syndromes, acute respiratory infections. Only brucellosis test is performed in quarantine center. Not enough health practitioners, no system of surveillance of zoonoses, no concrete actions found in the concept of One Health, lack of coordinated strategy between health, farming and environment ministries, no intersectorial committee for the control and food security. However, there are some projects underway, Project Regional Animal Network, farming projects in East Africa with epidemiological control, implementation, laboratory control, disease on the borders. Livestock Research Institute has launched a regional network of One Health to improve health. In conclusion, there is no concrete actions until today, but there are thinking for some projects. We hope the projects will go on at success. Thank you very much. Too short.
For observing time. Now we have reached a point where we are going to give you opportunity to ask the country presenters questions for clarification. So I will invite all the presenters. Please come back, please. Dr. Ali. Yeah, all the presenters, please, country presenters, come in front. I need some 5 chairs here. Anybody can assist? 5 chairs. And all the country presenters please come in front. So you take up some questions. And then I want to invite Yusuf to moderate this session. Yusuf, please come. 5 chairs, please. Oh, you have come with a chair. Thank you very much. Okay, just come. Just come and sit here. Need 5 chairs. Social distancing. You see? Then you can have another. Okay. Thank you, thank you. understood. Oh, it's enough, eh? Okay, Yusuf, please come in to moderate the session. So keep your questions ready for the panelists.
Thank you so much, Ozeri, the chairperson of the second day of the conference. This is a session for question and answering for all the presentations, great presentations that they shared with the One Health situation in Somaliland, the One Health situation in Somalia, and the One Health situation in Ethiopia, the One Health situations of Kenya, and the One Health situation in Djibouti. So, session, we want to have, if there's any question, to share with the presenters. These are the presenters from 5 different countries, and I would like to facilitate the questions related to their presentations. So it's an open, and I will give the floor. Yeah, I see here. Okay. Okay. So can we get another microphone?
Yeah, here.
Yeah. Yeah. Okay. Great. So Farah, please introduce yourself, just for your name, and where you represent, and then your question of interest, who is related.
Bismillahirrahmanirrahim. Good morning, everyone. I thank you, Yusuf, for inviting me to ask. I am Farah Isa Mumin. I am a postgraduate student at the University of Liverpool, and I also thank all the presenters that gave us the situation of One Health in the different countries, and it clearly we can see there is a disparity and difference between the different countries. For instance, Kenya and Ethiopia are ahead of when we compare to the other 3 countries. They have more than 10 years of experience in this area. They have already set up strategic plans. They have prioritized their national zoonotic diseases and so on. So my question is, what are the lessons that the other countries can learn, and how the different countries in the Horn can collaborate, just helping the other countries maybe within the coming years, so they can also try to set up strategic plans and prioritize the zoonotic diseases and so on. Thank you very much.
Thank you so much. Can we add questions in 2 or 3 one time? Then transfer to you. Okay. So I will give first the mom, then I will give you Dr. Adnan, then I will give you. The first question is related particularly for presenters from Kenya and Djibouti and Ethiopia. Yeah. Go ahead.
My name is Edna Adam Ismail, and here is the founder and president of Edna Adam University. I'm also here in my capacity as a very concerned citizen of the Horn of Africa. My intervention, or the reason I raised my hand, is to make a suggestion, a proposal that I hope those who have convened this conference and who will take on as a way forward. My proposal is that out of this very important conference that has convinced us all that we share the same concerns and we have the same priorities for the health of our people, our animals, and our environment, may I suggest that we come up with the Amud Declaration for One Health. And that declaration that is born here today becomes one that brings others in the region, academic institutions and government organizations, to strengthen this initiative. And I, for one, will give it my full support. We have encouraged other declarations. Global surgery started with a declaration, the Amsterdam Declaration, the Harvard and Lancet declarations. I would like One Health to benefit from a similar initiative as the Amud University One Health Initiative. Thank you.
So I will give representatives from BARNAAMIJYO University, and I will give you. Please interact.
Thank you, Mr. Yusuf, for giving me this chance. I would like to thank the presenters from 5 countries who symbolize the whole. Where we see 5 of you in front of us is really a symbol of synergy and collaboration of the Horn of Africa. As all of you know, and all of us know, this part of the world suffers a lot from many crises, as all of you know. Say, for example, war is a war-torn area of the world. Hunger is also one of the symbols of this part of the world. And the health crisis also the top agenda in this part of the world. So my point is, how does this region and 5 of you who are working separately come together, bring together the meager resource we have and fight the diseases, zoonotic diseases that our people are suffering from, and because you presented the separate countries' experiences. My question is, what does the experience look like before in working together? And how do you promise us in front of this big audience that you are going to work together in the future? In this regard, I would like to thank Amud University, Professor Suleiman and his team, for taking this initiative in bringing us together. And how are you planning to continue in working together? Because this Horn of Africa, this part shares similar fates, similar burdens. As you see, most of our people are pastoralists, and our livelihood depends on animals. So the zoonotic disease from animals to people, and people to animal, and the environment is common, and very much common, as we have heard from your presentations. So how are you going to work together, and how do you promise us, and how can you convince us? Thank you very much. Thank you.
Thank you so much. I will give one more person and translate to the presenter. So please.
First of all, I would like to thank the organizers of this workshop, which is highly important for the region. Also, I would like to thank those who presented since now. My name is Dr. Isa Noor Liban. I am from Borama University. I would like to ask one question, especially in Djibouti, and also some of the countries which have got seashores. I was away in the morning, but from the time I was present, I have seen a lot of presentations, but none of them has been including the marine products. So most of them are showing the cattle, sheep, and goats, and these things. So is One Health is excluded from marine products? That's my question.
Thank you so much. Thank you so much. We would like to first answer for the previous questions, but before they answer for the presenters, I would like the president of Ahmad University to say something about the very important
Issues and suggestions that they recommend Dr. Adna Adan. So welcome to the president.
I wasn't ready for that, but well, Adna's suggestion is well taken. Our suggestion. This is a normal practice in most this is a form of declaration or suggestions, points of agreements, actionable suggestions for the future are normally the practice in most international fora, the conclusion of significant fora. And this is no exception, I think. It's quite pertinent. And it also relates to Dr. Fiara's question, which says, how can we bring people of the Horn of Africa on these significant issues, vital for our survival? How can we, as universities, bring together? Actually, the two questions are related. The declaration as well as Dr. Fiara's suggestion. Probably within any declaration, there are certain actionable proposals that are pointed out, points of agreements that has the support of the majority of the participants, and I would hope and support fully that will, at the end of the day, when we come to the conclusion of the conference, subject to declaration, will be a basis for future actions and still form a point of agreement that future conferences on this topic will take into account. Thank you.
Thank you, Mr. President. So I will forward my microphone to the presenters so they will answer the question and how they are relevant. For example, for question 1, it's made for Kenya presenter and also for Ethiopia. So I will first give Joshua.
Thank you, Farah, for the question. Yes, we have got about 10 years of experience working around One Health. And as I mentioned in my presentation, Dismas was actually one of the initial people who worked around the idea of One Health with OSHARE. So I know maybe at some point we will also make a comment. But yes, there are several lessons. You know, as people come together, organizations come together, there are always stages of storming, norming, and so on. So we have worked with, for example, ILRI is not here. ILRI has always been part of One Health movement. University of Addis Ababa, we have always been together through HORN, but also GOHAI with Gebre's Wondwasen. So, and that started much earlier. So I think the way forward around this, of course, there are a number of things that we can do, but my last point in the presentation is thinking through how we can actually partner as institutions to move forward. Because then through that platform, the other institutions which are actually starting to implement this will then get to know how to navigate around those challenges. Of course, One Health, you have seen in a few presentations that it also requires investments around laboratories. And so yes, in Kenya and in Addis, these projects have supported labs. And for example, Horn has supported a lab, a government lab in Kenya, which is within a pastoral setup and been equipped with state-of-the-art equipment. So you also need to have such a support. And even before it's developed, for you to have your samples actually taken to these facilities for purposes of enhancing diagnosis would be quite useful. So I would say the beginning point is basically to develop some framework where we can actually work together. And that comes through the partnerships. Thank you.
If I for something with Dr. Muhammad or Topia.
Okay, Bismillah. Thank you, Dr. Farah, again for your nice question. I will summarize because lesson learned is a very good question, but the response needs a lot of details. And in a short, lesson learned have already begun in Amoud University. They have started, and this is a very good opportunity where you will have different universities who will share their experiences, their strengths, and their weaknesses. And Ethiopia is mentioned, expressed as one of the country in the Horn of Africa which has a very strong One Health platform. And still we feel that we are lagging behind a lot of things that we need to do to put ourselves in a better place. Therefore, I will attach the two questions. One is the lesson learned and how these regional universities can have a collaboration. So with that lesson learned is that first I will say just a start, even if it's a small thing. So it will go. And there are many challenges because the different sectors have experience in working in a silo. They wanted to be in an isolated environment, and there are many problems when it comes to, especially in information sharing. So just to start something, have document agreement between the sectors, and then start a small thing. Don't start with a big mission, but start with a small and it will go. And that's the reply on lesson learned. In the regional integration, as I have said, this is at the beginning and it's a very good opportunity. And I will reply that with the main concept of One Health. 3 C's. 3C. Communication, coordination, and collaboration. We have on slides, every slide in these presentations, all our colleagues have also mentioned, the problem is implementation. How can we start? Let's have a document. Let's start a small thing, and things will go on. Thank you.
I think the I think the question raised by the Haramaya University, which is how this region will bring resources and experience, that's always in every conference that comes, we usually talk about how can we collaborate and it's here. And then the realities in the ground, which is, you know, how the Horn of Africa region is. There are some political variations. There are limited resources sometimes, or even sometimes misused resources. So the best way we can use, if I can see, is, for example, to create One Health under IGAD so that it can coordinate all of those, and then the countries to put the resources over there so that all of us will have access, particularly in the academia that's involved in research and interested in research. Usually the countries, they implement strategies and programs that they politically agree. But the question academia, whatever these strategies needs to be evaluated and tested, so you cannot continue the same program without knowing what is the impact, what is the effect. So even that research contribution, the findings, will guide out the decisions to the policymakers and to also the resource, where to spend if we pool resource in that way. So this is a volatile region most of the time. Some countries are recovering from a long crisis, some are going through, and some are maybe looming, something like that. I hope it will not happen, but that's reality, we see it, but we will not stop it for it. We will have to do it, and the research contribution, because this is what the forum is, the research contribution to the all One Health components or the strategies, so that we can come up with what works. Can we invest here, or shall we dump money to here? Does it work? How long it can, and all of that has to be accompanied, so that we have to focus on the evaluation and base it, and then the implementation based on that research findings would be very good if we succeed in that. Thank you.
Bismillahirrahmanirrahim. Alhamdulillah wassalatu wassalamu ala Rasulullah sallallahu alayhi wasallam. I just want to add one thing in for Dr. Farah. Already most of it mentioned by Dr. Muhammad. I just want to add the misconception of the approach of the One Health, because in the presentation is done here, it's most probably talking about the zoonotic part. And I really appreciate Somali region of Ethiopia, led by the Jigjiga One Health Initiative. They already done the One Health approach and implement it, going with professionals in different sectors. Also, they forgot the agriculture. Maybe I did not see it, but the One Health approach, it is you have to know it. It is not a discipline, it is an approach from different departments. So to implement the successful One Health approach, we have to learn our people and increase their awareness on this concept. That is enough. For the question of the marine products, in general, when we're talking about the animals, it's included. Maybe you have seen the professionals that present in this sector. They are more prominent or more on knowledge on the livestock sector. But also we have marine zoonotics. We have, if you see in Mogadishu last week, you can find a lot of dead fishes, and it needs a lot to do in that area. Also, the people forgot for the wildlife sector. Thank you, Dr. Muhammad. He already mentioned the wildlife in his point. So, in summary, One Health is for all. Even the economics are entering for the cost effectiveness, increasing the livelihood. Thank you very much.
Thank you so much. because of time that we have, we can add 2 or 3 questions. Okay, so I will give one from that side, and I will give one from that side and the middle. So,
Thank you very much, organizers. First of all, I want to stress that this is a very important forum. Sorry, how is this? Yeah. One Health initiative is very sorry about the distractions. One Health initiative is such an important phenomenon that we have to take it forward. The takeaway that I have is partnership, communication, and collaboration. But the fourth one is implementation. Who is the target of One Health initiative? In my opinion, the target is the pastoralist, the peasant out there. How do we reach those targets? What kind of mechanisms does the program have? What kind of mechanisms does the initiative have of reaching out to the common man? One presenter talked of community prioritization. Community prioritization is not the same thing as community initiative. I'm saying this because I've had a lot of experience where we come up with very good ideas, but we put it down to the people, they don't take it up. We had a program way back in, sorry, my name is Dr. Eno Sokolo. I'm the Dean of Faculty of Agriculture and Veterinary Medicine at the Edna Eden University in Hargeisa, but I'm Kenyan. There's community health program which took the initiator 30 years to roll down by the government of Kenya. Just mere community health and development. So such a good initiative like what we have here, the number one priority is a community. Let it be community driven, not necessarily community prioritized. If it is community prioritized, that's good, but let them be the drivers. That is my comment and a question with it. Thank you very much.
Thank you so much. Back.
Okay, Assalamu alaikum. I'm Khalid, representing Save the Children and being part of Amud as well. I have a question. My question goes to Kenya and Ethiopia again, since they have done a lot when it comes to One Health, and they have a good experience on One Health. As an organization, we would like to know more about the new initiatives, and we have understood that it will minimize, or it will be cost effective when it comes to program implementation, even the ones we are doing, rather than conducting parallel system. My question is, you have presented some achievements that you have reached during the 10 years. Does the international organizations, including UN agents, contributed with your achievements? If yes, what was their role? And if no, is there a plan of collaborating or engaging them by implementing these new initiatives? That's my question.
Thank you. So I will also give this answer.
Okay. Right.
Put this here. Okay.
No, it's not on. Thank you very much, Yusuf. Thank you very much, presenters, for those wonderful presentations. As you could see, there is a wide range of experiences across the countries of the Horn, a lot of them converging, and there was some also divergences. I was mentioned there to say something about my involvement in One Health. I'll say briefly something about that. Then I will also raise some of my observations. OSHARE was an initiative USAID sponsored. It involved countries originally from Kenya, Uganda, Ethiopia, DRC, Rwanda originally, and then it spread to Senegal originally, and its main focus was capacity building, health workforce training the front line workers and students in the One Health approach. That was its main focus. It was launched in 2010 in Makerere. Ethiopia was involved, Mekele, and Jimna. And Kenya was University of Nairobi and Moi, and so on. And then it ran on, and then it transitioned to Afrohun. And in its lifetime, it also mentored Southeast Asian One Health initiative. We had partners in the US, Minnesota, and Tufts University. So it did a lot, but then it transitioned to Afrohun, Africa-wide One Health network. And then HORN was launched in 2018. This is British funded, and its main focus was research and training. And it has carried out a lot of training and research up to PhD level, postdoctoral level, and it is the mother of what we are seeing here. And clearly, it strengthened the research and the training in leadership and the research capacity, of which we hope we are going to reap the benefits. So, coming to my observations, two key areas stuck out for me. The question that kept on coming, and I think it came from Somaliland, Somalia, maybe also came from Ethiopia, where best to place One Health? Where best to place One Health? I think that kept on coming around. I think Kenya tried to answer it a little bit, and maybe they can share some of the experiences in where best to place One Health. And then the other concern that came up for me was the issue of surveillance, human and animal surveillance. In many countries, these are parallel, and they don't talk to each other. And if they are there, they are not formal systems of surveillance. And Ethiopia tried to answer this. Human and animal surveillance exists. Whether this is formal or informal, with structures, I think this is, for me, this would be, it has gone. Ooh, yes, so it's back. For me, this would be very useful across the region. If there could be some kind of a surveillance system for both human and animal, that one would be very useful. Everybody has got a culture. And then the last point for me is the ecosystem health. To me, seems to be weak across all. We're talking about animal health, human health, but ecosystem health is rather weak. On issues of partnership, I agree with Madam Professor there that there is need. And I'm hoping that on the third day, when we draw the declaration and with experiences from Kenya that have drawn a strategic plan, we may be able to proceed. Thank you.
Thank you so much. So I will give at the back, please. And the Regional Director of Ministry of Environment. That will be the last question. Okay.
Okay, first of all, thanks One Health Conference. My name is Jina Abduhab Hussein Mumin, representative of the Regional Coordinator of the Ministry of Environment and Climate Change. And I'm very glad to come to this conference. When I'm back from there, this meeting, and I have two questions. As we know, the environment is a very essential based on the two things, human lives and livestock lives. And as a Horn of Africa universities, do you have any programs intended to conservation of environment, and also this conference, which kind of role of this meeting and to environmental sustainability? Finally, thank you for your giving us the chance to tell you this. Thank you
so much. So the last question goes to the back, please. Yes.
Good afternoon, everyone. My name is Abdurrahman Mohammed from GIZ. My question goes to Dr. Mohammed Ibrahim from Jigjiga University. Dr. Mohammed, you said that you have trained community animal health workers and community health workers under the same roof. In one training, I mean. So I just more how that training went on, and how it worked and the impact. Thank you very much.
Thank you. The last one goes to Djibouti. I haven't seen any hands up to the ladies.
Bismillah ar-Rahman ar-Rahim. I don't have a question, but I have a recommendation or remarks. The on-health concept interests several ministerial departments, and I think it's require inter-ministerial collaboration and coordination before intergovernmental cooperation. Its interministerial cooperation is not existent now. That's why I propose an inter-scientific cooperation to be this concept carrier, and I propose the Amud University to be that locomotive. Thank you.
Amira, please box to the question.
Bismillah. First of all, let me congratulate all the presenters for the good presentation. My question is, to my knowledge, all One Health programs are implemented or supported by foreign agents. So as an African country, how can we have One Health that is sustainable, and what is your balance in achieving that?
Very good question. So I would like to give my phone to the presenters so that they can answer
Thanks for your questions. The question that the sister asked was One Health that's sustainable. The sustainability depends on many things. There are country priorities. So the different countries, when it comes to health, may have the same priority when it comes to One Health. It's all animal and human, and then the environment. But one program that we succeed in implementing and sustain will be governed by the resources we have, by the political commitment of the countries, and by the regional agreement or in that concept. But one thing is the capacity building. That's what I believe in animal and human health, particularly surveillance. So surveillance, it's a human capacity building, so can be easily implemented when it comes to animal health and to human health. And then we can collaborate during our investigations and then the reporting and also interventions. But I believe that will be the one that we can easily sustainable. I think that cannot be a consensus, but some may agree on other sustainable one. And that's what I believe. Thank you.
Just in summary for the sustainability, أحب الأعمال إلى الله أدومها وإن قل. Let us do what we can. Inshallah, let us take awareness for our community. We know in Africa or even in Somalia, a limited resource, financial resources, that we cannot go further for the One Health implementations as we want. But we can start, we can learn, we can give the knowledge, know-how to our community so as to prevent and contribute with us for the implementation of the successful One Health. That's great. Thank you very much.
Bismillah. I think I have 3 questions, so I will leave the rest. Some of them are comments, but I will go directly to the questions that raise it towards me. I fully agree with from Nairobi, from Ahmud, about the community prioritization is not equal to community participation or participatory approach. I fully agree with you. And in Johi, Jijiga One Health Initiative, so what has been done is, as I have said in my slide, it's bottom-up approach. And sometimes the trick thing is that there is a goal for the project. There are priorities that need to be in alignment with the strategies of the government. And sometimes there is a clash between the community priorities and the government priorities, and you should have to balance in that. But I fully agree with you that community participation is misunderstood and misimplemented. The second that have been raised to me is the human from Nairobi University, human and animal surveillance system. It's in everywhere, and I fully agree with the parallel system of this surveillance and information sharing, because the human health has their own system, and veterinary, for example, in Ethiopia, in the veterinary, they have a DOVAR and ADNIS system, which is one is paper-based and one is electronic. So it goes directly from the Warada or the Kabele, which is the lowest administrative unit, directly to Federal Minister of Agriculture. They summarize the data and back to the regional state. Unfortunately, that information is not shared with the Minister of Health in the same place in Addis Ababa, both of the ministries. So it needs a long process and a huge commitment to integrate the two systems, because we don't want to create another system rather than those systems which exist already should be integrated, and that it's not an easy task, but it's the same in Ethiopia too. And the third is the community animal health workers and the health extension workers. Because of time, I didn't explain well. What we did is, in health extension workers, they have 16 packages, which the Regional Health Bureau trained those at the community level. They got the certificate with these 16 packages, and then they do only the activities related to human health sector. Whereas community animal health workers are doing the same in animal health sector activities only. Unfortunately, in Ethiopia, community-based animal health workers is not recognized at the government level. It's not in the system, so many people are not interested in training in community animal health workers, likewise of health extension workers. What we did is, at the beginning of the training, you train them together, because these people are from the same Kabale and they are targeting the same community, but they don't share information. Do your activity, but if there is any outbreak, just to share with your friend who is working in the other sector. So we train them in one health approach, and then separately, we don't train human extension workers about animal health and so on, and vice versa. And that's what we want, is to use one health approach when they are doing their own routine activities. And lastly is about One Health sustainability in Africa. In general, the problem is, I mentioned in my presentation, we need institutionalization and internationalization. And that needs a long process, So One Health sustainability in Africa needs that many One Health activities are fragmented. For example, Horn is there. There is also Ohio State University-led initiative, which is One Health initiative. Okay, and what I wrap up with that is, let us bring all those initiatives together by using shared resource, and then that will lead to our sustainability. As Dr. Ahmed said, just let us start a small thing. That will work. Thank you.
Okay, thank you so much. I think I'll be quite brief. With regards to, we are calling it One Health Initiative. I think he has mentioned the right term. It's actually an approach towards solving challenges that actually we have within the various communities. Because we have realized that working in silos does not actually help us to achieve so much. So Dismas has talked about surveillance. Yes, we still see a bit of rigidity with regards to the various professions handling their own data, livestock and human. But in Kenya, there is a system which has been recently introduced, known as the CABS, Kenya Animal Surveillance System, which tries to integrate these two data sets. It's a recent development. We are yet to see how it's actually going to pick up. Thank you.
Thank you so much. Thank you for all